Hi, Kevin Henry, the Group Editorial Director for Advanced Stars Dental Division and Modern Hygienist, and I'm on a Google Hangout today with my friend and America's dental hygienist, Anastasia Turchetta. Hey, Anastasia, what's going on?
Hey Kevin, not too much. Just worked a clinical hygiene day, saw a lot of patients, and of course, you know what maybe one of the topics could have been, which is our topic.
Well, let's talk about that then. You know, Ebola has certainly captured the headlines around the country and around the world, and for a while there, it was very much a health scare. Dental professionals are always coming into contact with patients. You don't know where they've been, what they've had, what they've been doing. So, as a dental hygienist, is that something that you worry about, or what's kind of your approach to that?
Well, that's a great question. Actually, the American Dental Association came out, I can't remember if it was today or it was at least this week because our rep came by and showed us what was going on, which is nice. I think that helps to alleviate the fear. But you know what? It's not like we can, have a passport and have people just sign in and say, where have you been? Now, although saying that, I believe that the ADA did state that any dentist who believes that there is a viral infection that's suspected, then they have the right to actually take the medical history and travel history from the patients. Now that I didn't know, so I find that helpful information because as much as I can, be sarcastic about it, they actually, you can do that if you suspect a viral infection, but by the time it gets to us, Kevin, you've got to be in some really severe pain
Right.
to even worry about Ebola or having a patient who has it.
Yeah, the illness has to have progressed quite a ways before it's really something that you've got to worry about.
Right. I'm not thinking someone's going, oh, got to see the dental hygienist.
Yeah, if you've got that, your hygiene's probably the least thing on your mind. But
Yes, I think so.
But it still set off a lot of fear. I mean, there were a lot of I had a lot of dental folks message me on Facebook and everything else saying, is this something we should be worried about? What do you think? And the simple truth is, I mean, you've done some research, and it's something that, yes, it's a horrible thing, but it's also something that is, there are a lot of other things that we should be worried about.
Exactly. I mean, you and I both travel, and I traveled this past weekend, and I got to tell you, I was a little hesitant. I'm already a partial germaphobe, but the point is, if people are really that worried, then they should cover their mouths when they're sneezing, and that's not happening in the airports. I don't know what you've seen, but, even my seatmate is coughing up a lung, and I'm thinking, do I have the right to ask her, hand her a sanitizer, a mask? I don't know. Any kind of PPE I can give her, would be helpful. But you're right. I mean, the chances of catching that are like, what was the one article we were reviewing? Like, what are the top 5 things that you could get outside of it? And we were, being struck by lightning,
Yeah.
crunched by a vending machine, something like that.
Yeah. Yeah, there's such a small chance of getting Ebola versus so many other things. And, with flu season, getting ready to hit high gear, I mean, it's something that, like you're saying, just take some precautions. Cover your sneeze. Do some things to keep yourself from getting the flu. Don't worry about Ebola, but, other kinds of illness that can take you out of the practice.
Exactly. In fact, I think there was something to do with, they really, I think it was the Huffington Post. It was a great piece in the fact that they took different diseases such as smallpox or measles and AIDS, and they took that and the flu, and you can see that it makes sense why the flu completely contaminates everybody within days. I think it's like 2 to 4 days. Whereas Ebola and different other things like that, they've got like a 14 to 21 day window, yes or no.
So you're a germaphobe, but you're also a dental hygienist. So how do you kind of protect yourself during the cold and flu season? Really make sure a bug's not going to get you.
I do get the flu shot, and I will tell you that I've got hand sanitizer with me all the time. Traveling makes it a little bit of a challenge because I really did think about the mask. I was like, okay, Anastasia, and I just looked at the numbers, and when you do see somebody sneeze and they're not going to cover their mouth, of course you think it because it's coming out as quick as an airplane is flying through the air. In the same token, you got to be real. I mean, look at how much aerosol we're breathing every single time we put the ultrasonic in somebody's mouth. If we're not doing a pre-rinse with an antimicrobial ahead of time, I mean, that'll wig you out enough.
Well, there's
It's
something else.
basically, hand sanitizer and washing my hands, pretty much what they say to do.
Well, you just gave us another thought to think about besides vending machines and being struck by lightning with that one. So nice.
Here to help.
Wow. Okay. So, any other little health tips that you want to pass along, or or to tell our readers as we head into the holiday season as well coming up?
I would say if you are an aging patient, and obviously watch out for our patients. I know my mom's aging, your mom is aging. People with a compromised immune system, I would place at a higher risk because they can't fight off something such as the flu or the common cold as easy as what you and I can. So it's really look into your environment. What did you get the flu? Vaccine, or are you protecting yourself from the cold? Also, the other things too is, nutrition wise, what are you eating? If your immune system's down and you run out from stress, what are you putting inside to protect yourself? So, a couple different things.
Good points all around. I appreciate it, Anastasia, as always. Thanks so much for your time and insight.
Thank you for having me.